everybody. I am now 10 weeks pregnant, and 10 weeks and 2 days actually. I had my first ultrasound in December, and there was a little bit of concern there because the doctors weren't able to find the baby, but I was only like 5 or 6 weeks along, so it was kind of expected that they wouldn't be able to find anything. Then I had my first OB appointment. That was on January 4th, and everything looked good. I had 2 blood draws done after my ultrasound to confirm that my pregnancy was going along well, and according to the blood draws and my hormone levels and all that stuff, everything was fine and going along as it was expected. So that was good news. Still a little bit stressed that they weren't able to find anything, but like I said, it was expected because I was so early on. The OB appointment was really kind of just a medical history. They, took my medical history, my fiance's medical history, things like that. Unfortunately, we had to drive an hour away for our OB appointment because the only hospital in our area that will do a VBAC is that hospital or one in the opposite direction, and it's an hour either way, so we picked the city we were more familiar with. And for those of you who don't know, VBAC is a vaginal birth after a cesarean, and I'm just under their limit. They allow up to 3 C-sections for a VBAC, and I've had 2, so I'm just under. And just a little bit of more on my history. My firstborn was born when I was 19, and she was born by a scheduled C-section. From the very beginning, I insisted that I wanted a vaginal birth, natural, no medication, and the doctor that we were going to said, no, you're too small, you're not going to be able to have a baby naturally. And when I told him I didn't want to do it with any medicine or have, an epidural or anything, he's like, well, then I don't want to deliver for you because I don't want to hear you scream. I should have left right then and there, but hindsight is 20/20, and I didn't. I went in at, I think I was 36 weeks pregnant, and he did my fundal height measurement from the bottom of the pubic bone to the top of the uterus, and it measured on 36 centimeters. And I went back the next week, it should have measured 37 centimeters, and I was at like 42 centimeters. And he decided to go ahead and schedule a C-section for the next morning. So my daughter was born by a scheduled C-section, and she was a large baby for my height. I think I said on the last video, I'm only 4'10" and a half, and she was 8 pounds 10 ounces and 21 and a half inches long. My second child was born when I was 21. He was also born by a C-section, although I did attempt to do a VBAC with him. I had a midwife, and she allowed for a VBAC. At the time, that was local. Apparently the laws have changed in 7 years, and they no longer do that in our town. But anyways, I was in labor with him for 32 hours, and they gave me a C-section because of failure to progress. I was still only at 1 centimeter dilated after 32 hours. And the doctor at that point in time told me that it was impossible for me to have, I can't remember the exact word that he used, but basically I couldn't have labor that was going to do me any good. It wasn't going to be beneficial. It wasn't going to produce a baby by me having contractions. My uterus just wasn't strong enough. I'm pretty sure he was wrong, because when I had my miscarriage, I started bleeding, and I went to the emergency room, and they told me I was having a miscarriage. They said I could either have a D&C or I could wait until, I passed the baby on my own. And I decided to wait. And 2 days later, I woke up with excruciating pain, and I thought that I had an infection in my uterus because of the miscarriage, and I was rushed to the hospital by ambulance, and I was probably there for over an hour before I realized that the nurse was actually looking at her watch and then looking at me and then looking at her watch and looking at me. And I looked at her and said, "Am I having contractions? Am I in labor?" And she said, "Yeah, you're in labor. You're going to be delivering your placenta, and um, you're basically your baby." And I did. I delivered the miscarriage and the afterbirth and all of that. And of course, it was really, really, really small, but I was able to have active progressive labor, and I was dilating and dilated enough to pass that, and it was large enough. The baby wasn't, but nonetheless, I did have effective labor. That's the word I was looking for earlier. I did have effective labor, and so that doctor was wrong. My next appointment will be on January 20th, which is next week on Thursday. And that one I will actually get to meet one of the midwives at the practice that I'll be going to. Again, that appointment's going to be an hour drive away. It's a little bit far for us to drive, but I really want to have a vaginal birth. I want to go naturally, again, with no medication, and looking at possibly doing some hypnobirthing classes in Cleveland, Ohio. So we're looking into that as well. If we can't get the classes, we're just going to order the at-home kit with the books and the DVDs and the CDs and the whole 9 yards, and just do it ourselves. The due date for the baby is August 6th. I was in the ballpark. I had decided it was between August 6th and August 11th. As far as symptoms go, the first symptom I experienced was severe breast pain. The second thing I've experienced is pregnancy mouth, not being able to talk, fumbling over my words. It's pretty horrible. And nauseousness. I don't just get morning sickness, I get what I call whenever the hell it feels like it's sickness. I am nauseous all day long from the time I wake up to the time I go to bed. There really is no fix. It doesn't matter if I eat, if I don't eat, if I, take Tums or whatever, I'm still nauseous all the time. Every now and then a peppermint disc will help, or, most of the time I just end up laying down. But nothing really seems to quell the nauseousness. My family doctor, prescribed me, I think it was Zofran, an anti-nausea medication, and it did take away my nauseousness. It worked. I've only taken it twice because one of the side effects is it gives me a migraine, which in turn makes me nauseous, so not so helpful, because then I'm nauseous with the migraine, and that's a lot worse. So I'm just dealing with the nauseousness as it comes. I've also had to buy myself, well, I haven't bought any yet, but I've made myself a pair of maternity jeans because all of my pants are too small, and I end up just leaving them unbuttoned and folding them down. And I'm almost out of time with my video, so I'm going to show you my belly as it looks now at 10 weeks and 2 days. There we go. That's my belly. There we go. That's sucking it in. That's as far in as it goes. And yeah, my pants don't button all the way. I have them unzipped and folded down, and yeah. So that's it for now, guys. I will talk to you the next time we make a video. Later.